Hi, I'm Michelle Phelan, nutritionist at Blossom Bariatrics, and today I really want to go over the top 5 supplements that I recommend at our practice. So first and foremost, your multivitamin. There's so many delivery systems out there, basically anything but a tablet, okay? So that opens up the door to drop sprays, sublingual capsules, gel caps, chewables, gummies, oh my goodness, transdermal skin patches, okay? So lots of delivery systems to choose from. Here are my top favorites. I do like the Alive by Nature's Way gummy. This product does pack a punch, and we've had patients do phenomenally well on this product. Again, it's a gummy, and I don't know, people really like it. It's one of our top sellers. They have women's formulas, men's formulas, but generally this gummy does really well for those of you who like gummy delivery systems. So the Alive by Nature's Way, my pick for a gummy. My next pick, of course, would be capsules. You guys, you can do capsules if you can swallow them, not a problem. They have to be a bariatric formula, okay? Remember, I only recommend products that have been therapeutically dosed to meet the needs for bariatric post-ops. You guys have special dietary needs now. You are a weight loss surgery patient. You have different needs than everybody else nutritionally. All right, that being said, I do like Bariatric Advantage. They're ultra multi. They do have with or without iron. Only you and your doctor will know by your labs if you need iron or not. Please get your labs checked regularly for iron. Anyway, I just picked up this one. This is without iron, but it's a capsule. And again, any bariatric formula, Bariatric Advantage, Celebrate Bariatric, Bariatric Fusion, any of these brands for bariatric patients usually will suffice. Capsules. All right, so then we have chewables. Okay, so this one just happens to be the Celebrate we carry here at the clinic. It comes in many flavors. These are chewables. You know, I think most folks like them or can tolerate them really well. Again, so most bariatric formulas do have a chewable version, and it depends on what texture you like after surgery. Some folks like more of a gummy, some folks like a chewable, kind of more like a sweet tart, and some folks just like to take a capsule. So again, lots of delivery systems for your multi. Now this one I've been hearing a lot about, and it doesn't have to be this brand. Bariatric Advantage is just one of them that we carry. These are Chewy Bites. They're kind of like Starburst, okay? So if you do like that texture, like a toffee kind of texture, or like a saltwater taffy, or a Starburst texture, and you do like that, then this would be the one for you. Again, any product made for bariatric patients has my stamp of approval typically, okay? But if you have questions, please email me. Again, so this is a delivery system. And something we carry here at Blossom are the transdermal skin patches. This happens to be the multivitamin version. Now, what I tell folks when I talk about these transdermal skin patches is this. It depends on the integrity of your skin, all right? Because the skin, actually, your skin will absorb 60 to 70% of whatever you put on it. Hopefully we put good stuff on our skin because that goes right into our blood. But transdermal skin patches, they're developed so that the nutrients do get into your skin transdermally. The integrity of your skin really matters. You want to make sure that wherever you place it, your skin isn't dry, it's not crepey, and that it has great circulation. So that's something to take into consideration with your transdermal skin patch. There's many formulas by this brand. I just picked up the multivitamin version formula. All right, there's the multis. Number 1, the multivitamin. The second thing I recommend are the B vitamins. Folks, there's 8 B vitamins in the B vitamin family. B12 is only one of the 8. Get a B complex. You're getting all of them. Okay, do not hunt and peck and take. Biotin is one of the B vitamins. B12 is one of the B vitamins. Folate is one of the B vitamins. Okay, your best bet is to take a good comprehensive B complex. Now, these just happen to say B50. This one just says B50 as well. These are bariatric formulations made for bariatric patients. Sometimes they're called B100s, Happy B, Sunshine Bs, B complex. Regardless, I always recommend a B complex because even though you're getting B vitamins in your multivitamin, it's very important to take extra. All right, B vitamins are flushed out daily. They're water soluble. As a bariatric post-ops, you're probably in need of a lot of B vitamins, particularly for the first couple of years after surgery when your poor liver is detoxing all those toxins from the very quick weight loss, okay? So your liver really needs these B vitamins for methylation. Speaking of methylation, you guys, let's talk about B12. The only B12 you should ever take and that you should ever look for is methylcobalamin B12 with an M. Think of methyl meth, okay? Methylcobalamin. It is active, it is methylated, it is ready to go for your body. Your body doesn't need to try to find a methyl donor from somewhere else to make that B vitamin active. Folks, if you're a weight loss surgery patient, look for methylcobalamin B12. Anyway, so the ones we carry at the clinic do contain methylcobalamin B12. Remember that. All right, so here we go. The next thing I recommend, number 3, your probiotics. 80% of your immune system is right there in your large intestine and your colon, folks. Remember. All right, the ones I recommend, we have at the clinic, Megaspore probiotic. This is my favorite. I save this one for my hardcore patients, those of you who with IBS, diverticulitis, Crohn's, autoimmune disease, bloating, digestive issues. This one I would recommend taking it for a month or 2. You have to order it from us online or here at the clinic. It is a very targeted formula. But generally, folks, a good, well-rounded probiotic with at least 5 to 15 well-researched strains. And this is something I just like to say. You want to look for something with the most billions of CFUs, okay? CFU stands for colonizing forming units. You want to look for as many billions as you can. So anyway, this one, of course, is by Bariatric Advantage. We carry it at Blossom. It's a nice, well-rounded formula. Any probiotic you get at a health food retailer will be pretty good. All right, ones I don't ever recommend are ones from yogurt or gummies. Not a good delivery system. Remember, those probiotics need to make it alive and viable to your large intestine. They need to make it through the acidic pH. The large intestine is where they like to hang out. Okay, it's just alkaline enough in your large intestine and colon for these dudes to hang out and then repopulate and create the health that your body needs. So anyway, probiotics, they help you use the restroom. They help balance out your blood sugar and insulin levels. They help you create vitamins, and there's so many things that probiotics do. I do have a video on those as well. I do recommend probiotics. Number 4, probiotics. You're going to thank me. All right, last but not least, this is no wait, that's number 3. Sorry guys, I get really excited. Number 4, your omega-3s. Omega-3s, you guys, are found primarily in cold water fish like cod liver oil, salmon, sardines, and krill. But you'd have to eat pounds of this stuff every day to get the therapeutic doses you need, and one little purified gel cap. Just take the gel cap. It's really easy. They also come in liquid form, and before you think of grandma's cod liver oil, it's not like that anymore. They've come a long way. Now they're, if you do want to do a liquid and kind of swirl it into your protein shake or just take a teaspoon of it, they're emulsified with delicious sugar-free flavors now. It's almost like syrup. However, most folks like to do a gummy version or the gel cap that slides right down with just a sip of water. We carry the Twin Lab one here. I do recommend the Mega Red Krill. That's another really, really good one because the gel caps are really tiny. So they do go down with a sip of water. Omega-3s basically are anti-inflammatory in nature. I call them nature's Advil. All right, they really help with all sorts of pro-inflammatory conditions in the body and also with blood sugar dysregulation. So I do recommend omega-3s as the top, the last one rounding up, number 4. Now there's always extras. People say, well, okay, Michelle, why are there so many supplements? Why do you talk about supplements all the time? Basically, you guys, you'll be taking supplements every day for the rest of your life because food is where you would normally get your nutrients. But the beauty of your surgery is that you're hardly eating any food. So when you hardly eat any food, you gotta find those nutrients from other sources. It matters where you get those nutrients. You wanna make sure that your supplement of choice has been tested for potency, purity, absorption, and assimilation. Anyway, that's what I have, top 4 supplements. I've got to cut it short. I could talk forever about supplements, the top 4 supplements. You guys have a great day. If you have any questions, please visit our website at www.blossombariatrics.com.